Hi everyone, I'm Harsh Nagpal and I'm your host for today's podcast. In today's podcast, we are in talks with Dr. Raghavendra Ramanjulu from Aster CMI. He's the lead consultant in the Department of Pain and Palliative Medicine at Aster CMI. Thank you so much for joining us today, Doctor.
Thank you, Harsh.
So, Doctor, these days, back pain, neck pain is a very common issue. It's become so common that it is, rightly called the new age pandemic. And most of us tend to ignore it, considering it that, every second person has back pain, every second person has neck pain. But a lot of us also blame it on, maybe bad lifestyle or long working hours. And we totally tend to ignore it. But do you think we are in the right track?
To answer that question, it all started with COVID. And with COVID, work from home. Work from home caused a lot of gamut of concerns.
Long working hours.
Absolutely. And isolation and other things. To add to that, they started sitting on their couches, sitting on their beds, sitting on whatever they want, and looking into the phone, gadgets, tablets, and other things. Now, once ergonomics, that is how to sit, how to stand, how to work, is lost, obviously your neck and back get strained first. Now, everybody were thinking, saying that back pains and neck pains are going to be something of some age or some factor, something which is related. But unfortunately, it's caught up to the younger generation also now. The entire spectrum, which was actually thought this is an age related disease or age related concern, is actually got into the younger generation also because of use of all these gadgets and the lifestyle change which has happened thanks to COVID. After that, it's not only affected their lungs, it's affected their neck, back, as well as their life completely.
I think that's what a pandemic does to you. It takes a long term impact.
Absolutely.
We
So,
tend to ignore what else it's doing to you. As Sir rightly said, it is not just your long working hours. It is not just, there's something more to it, is what we are going to get to know today. It's not just blaming it on your lifestyle or the gadgets or long working hours. So, doctor, when I was reading about you, I heard a new term called as pain physician. Till now, whenever I faced back pain or neck pain, I was consulting a physician. But today I figured out this new term. So tell me more about pain physician. What exactly
so
happens?
most of the concerns which are going to be handled by a general medicine person or orthopedician, neurologist, or a neurosurgeon when they have a neck pain or back pain. That's where generally they go to. Now, when you are actually with a physician who is actually trained to give you medications, physiotherapy, and others, that is one component of management for neck and back pain. Whereas if you go to an orthopedician or a neurosurgeon, it's a surgical intervention they are looking into. Now, there is something called as minimally invasive pain interventions, like injections and other things it could be. So a person who is trained in these kind of spectrum of management, which could be individualized for that person, is going to be carried by a pain physician. Now, most of them will think, is this pain physician a doctor, physiotherapist, or who is it going to be? So pain physicians typically around the world are all anesthesiologists who have actually done their anesthesiology, and then they've actually specialized into pain management and interventional pain management. That is where the new the context of handling what was not there before is going to get handled by these group of doctors.
So our number one understanding is if we have back pain or neck pain, the right person would be a pain physician and not just a physician.
Just going to a chronic pain physician at the start itself might not be relevant. Now, if you have gone to your doctor, could be your general medicine doctor or your orthopedician or your neurosurgeon, and the pain is actually continuing after a period of 3 to 6 months, and still the pain does not have an answer to it. Now, you have tried physiotherapy, you've tried medications, you've gone to a surgeon, and the surgeon says there is no need of surgery, or the surgery is advised, but you're not in willing for a surgery. Now, is there something different which could be done just from this, what I've already gone through? Then approaching a pain physician, or you don't have a diagnosis to your pain also. That also would lead to them to come to a pain physician. This is where the context of actually having this new super speciality of pain management all comes across.
So, doctor, when a patient walks into your OPD, what are some of the common symptoms that you notice,
The
especially related to back pain and neck pain?
So most of them, when you have a chronic pain, like more than 3 to 6 months of pain, you would have gone through a lot of, could be X-rays, MRIs, met doctors, despite that you're not getting that pain relieved. That is where it starts affecting them as an individual. What happens? Now, if it's a young individual, he'll not be able to go to work. He'll not be able to socialize. He starts getting isolated, not only in the younger group, could be in the elderly group also. It's not only neck pain and back pain. Now, in the elderly, they could have shoulder, knee, hip, other concerns also because of degeneration. Now, once you add these other complex concerns, then it becomes a holistic problem. It just does not actually relate to only as neck or back pain. It starts becoming a generalized problem for the person. He starts becoming more and more retracted, feeling left alone, hopeless, and helpless. And the longer the pain you have, the longer these concerns are going to be of an impact for him. And the relief also becomes that difficult for that person to think about. He would actually start thinking negative, saying that, am I going to live with this only? Am I going to become better or not? Is there somebody? I've done everything. And my kith and kin, who are the loved ones with me, are also feeling to saying that, is there everything in my head? Or is there an answer to this or not? I've done everything possible. Is this something which is even going to become better or not? I've not been able to go to office. I'm not going to be able to do anything. And my revenue, other things are also getting lost. So, and to add to philosophical touch to it, God, have I done anything wrong? So these are certain varied ways of presentation the patient might actually come up to us. So they might be having a simple physical concept of pain, but psychological, social, spiritual, and other concepts could be much, much higher in them. So that's where we could actually look into.
So, apart from back and neck pain, what are some of the major or different other kinds of pains that you usually hear about?
So in a typically chronic pain clinic, what we see is patients who have got pain more than 3 to 6 months. Patient has gone to their primary physician or a doctor who's not able to get the pain solved. Diagnosis is there, but surgery is not the treatment plan here. Medications taken, physiotherapy done, not better. So diagnosis is one. Or this patient has got multiple comorbidities, uncontrolled diabetes, uncontrolled BP, 2 cardiac surgeries done, I'm asthmatic, I can't undergo knee replacement, I can't undergo hip replacement, shoulder surgeries, I can't do these. Is there anything else a doctor can offer? This is all something which a pain team or a pain treating team would be able to offer. And the conditions which we come across, headaches, different kinds of headaches, from simple migraine, which is commonly seen, tension headaches, cluster headaches are there. There's so many from headache. Now, neck pain and back pain, already you have mentioned. Pancreatitis, abdominal pains, endometriosis, gynecological pains, and you have got hip and pelvic floor pains. You're going to have urological pains, knee pain, shoulder pain, plantar fasciitis. The number of discussions which you're going to have is going to be limitless. So therefore, definitely we could have all these conditions being managed here under one roof after a specific diagnosis made to it.
So, doctor, as you mentioned about the n number of pains and it just keeps adding to the list, are you seeing an uptrend in these pains? Are you seeing more and more people walking in with these trends? And if yes, what does this tell you as a doctor?
It depends upon what's happening to the entire lifestyle changes which we have gone through now. Now, COVID is one of the conditions which has actually made us go through a little bit of it. But your work, you're related to stress levels, you're related to your sleep, mood patterns. These are all very, very important from the individual's perspective. Then external factors are there which can play, like traveling, how much you're going to travel, what type of travel, how do you going to do this. Now, from that perspective, now next is your support at your work is good or bad. If people are colleagues who you enjoy to stay with, you want to work with them, you want to do things, that's also going to be of real relevance.
Your mental well-being.
Absolutely. So work-life balance, what's happening at home, however other people are there, all these things actually become the most important aspect for being content.
Right.
If content is not there, then obviously you are going to be in a lot of disarray. Now, disarray is there. Chronic concerns are going to affect you more and more and more. If you are a genuine person who's going to be a type A personality, who's going to be a go-getter, who want to finisher, things like that, then your personality becomes very important over there. But if you're type B, type C, or type D, who's going to sulk for everything, who's not interested, who's going to be negative about things like that, then your smaller concerns also become a huge burden there. So it is a multifactorial, multi-prong approach which is required. So hence, this is not like one question, one answer, or one problem, one solution. So it is going to be a holistic way of actually looking into a concern, and also giving an answer to that person in that holistic sense makes a lot of meaning for them, because they would be searching for this kind of an answer, rather than most of them in this era would also start searching, googling, doing other things also. But unfortunately, they might not be hitting the right page or right place to actually check for those answers, and obviously that is where they get lost. So from that aspect, I think understanding that individual, getting to know what is he going through, understanding his concerns and problems, and how to actually get that sorted out for him in the best sense, is all chronic pain team does for that person. So it starts with the right kind of diagnosis. If the diagnosis is not made, and if it is made, if medication, other things are there, non-pharmacological measures, because most of them will go to a pharmacy, pick up medications and take medications, and they are there with it. But that might not be the right approach. It's a solution for that hour or that day or that week. But what they would have already gone through is for months together. And these medications and other things might not be the right kind of approach, because it might affect your vital organs like kidney issues, heart, liver issues. So all these things are something which we will definitely look into and then take it ahead.
Doctor, I really appreciated how you linked mental well-being with physical well-being and your mindset along with personality as well. I can see the connection, as you said. Maybe somebody might be going through something very small, very minimal, but because of his mindset, because of his social stigma or whatever situation he is in, he builds it up. It keeps building, and right. I really like that point. So, doctor, going ahead, do you notice a trend or an increase in tier 1 and tier 2 cities? For example, maybe a Bangalorean, like we are known as a city of hustle, we are known as the next city that never sleeps in India. So do you feel that back pain and neck pain or any of these chronic pains are more common in cities like this?
It is true, it is possible. Now mindfulness is what the next concept is all about. Now if you're sitting in a place where you would love to, now it's quiet, people are all there, and you've got all the time in the world, obviously if you enjoy that, it's going to be much much better. So mindfulness gets linked to it, what we linked last time to this. Now in the hustle and bustle, what you're talking about, you're running, your time is at stake, and you'll have to complete tasks, then deadlines. Once this starts in, the being content, if a person wants to finish in his own time, would not be able to give that time. And if he's not able to enjoy his meal, he's not able to do anything, obviously his content is going to be less, mindfulness going to come down. So obviously all these things, the depth of sleep also, let's take it as an example. Now if you've got a limited time to sleep, now it could be 5 hours or 6 hours, and if you don't sleep to the adequate level you want, the depth is what is important here, then your muscles don't relax. If muscles don't relax, your chronic pains are going to be a concern. Muscle is the largest organ in the body, and if we are not able to actually have a mindfulness of relaxing this, obviously we will not be able to be much better at all, and we will not wake up fresh next day morning. We will not be able to raring to go to do work, and that sulking again starts. So therefore in metros, obviously it could be much much more. Or a person who doesn't get bothered by this at all could be a person who's enjoying this, and you put him on the contrary to a place where it's quiet, he might actually get really affected there. So it's contrary, vice versa. So as I told, we'll have to look at that individual, what's there. Yeah, but by and large, it could be more in metros, what we're talking about, because of the deadlines not being there for their loved ones and things. Yes, it could affect them much much more compared to a place where it could be type 2 or type 3 tier cities. Yes.
So, doctor, since you mentioned about the sleep pattern, what would be an ideal sleep time and wake up time for our muscles to relax according to you? I know there are a lot of stats, a lot of this, it's all out there, as you said, on Google, but I'd like to understand from you what would be the exact or the best sleep window that you would suggest.
So it's about 8 hours of sleep is what everybody would actually put across, like one third, one third, one third. 24 hours you divide, at least one third you have rested to become much, much better. But if you're a person who would actually practice mindfulness, obviously it could be a lesser duration, but the quality of sleep is what is much, much more important over here. You might be lying down on bed thinking you're sleeping, but if your depth is not okay, then your muscles will not be able to relax. Some people might have a thought running in their mind. So this is something which will not allow them to sleep, or a deadline which is not allowing them to do certain aspects, which will make them really worried. Now, these are other concerns which we are there. Typically, 6 cycles of REM and NREM, a little bit of technical, which I'm talking about. Deep sleep and a superficial sleep is what we differentiate categorically. If your deep sleep is what 6 cycles happen, then your muscles relax really, really well, and you feel refreshed next day morning to actually get back to your activity of daily living.
So, doctor, do you relate pains with clearly with age, or do you feel it is more of a lifestyle issue?
As I mentioned earlier also, it is each age group will have certain predisposition. Like 60 years could have knee pains, knee osteoarthritis, shoulder concerns, and hip concerns, and things like that. They're predisposed. But it in this new era, as you spoke about metros, type 1, type 2 cities, deadlines, it could actually affect their lifestyle also. So therefore, that also will have further degeneration happening at an earlier age. And trauma, because you're lifting weights, doing things, that also can cause a lot of trauma. And micro trauma is very, very important. What is micro trauma? Dedicated every day, having no stretch, no time to relax, will allow your muscles to become taut. Once they become taut, you're not relaxing at all. Either it could be sleep or stretching or activity or exercises. You're going to work, you're going to drive to work, you're going to sit over there for 8 hours, you're then coming back, you're in the household chorus, you're there itself. So you've not been able to exercise, stretch, do anything. Neither your sleep is actually better off. If this gets combined, obviously you are not going to be there. And those earlier shifts of 8 hours are not there anymore. Those shift timings are all off. So you're working as a 24/7, definitely your relaxation and other things don't happen. It's just not the sleep which gets you the relaxation. It's even your work-life balance also becomes very, very important over here. That's something which we will have to look into.
So, doctor, do you feel that these pains are maybe something that we can relate with genetics or gender oriented?
Gender wise, yes, there is a predisposition to women a little bit more compared to men. Reason being is hormonal changes, issues and concerns with childbirth and others could have some forms of pains related to them. Could be low back, could be other things. Whereas genetic, as I told, personality traits and other things could be actually carried over from them. And if you're a person who's going to be type A, type B, type C because of your genetical factors and things like that, it could be a little bit better handled or worse handled. So both will have impact for sure. And your question is apt, wherein people might think saying that, am I getting everything genetically? Have I to blame only my genetic predisposition? No, you will have to actually look into how to make this a better aspect for you and how to take this ahead.
So let's say there's a person X who keeps facing pains often, but he's a person who tries to diagnose himself. He just pops a pill, maybe takes a painkiller and just keeps going on the go. He gets his temporary relief and maybe even relief for a longer period. Do you suggest this a good practice, or do you feel he should be consulting a doctor?
So if he's got one episode of pain, neck or back pain, obviously that's okay to actually neglect. That's wherein he's taken medications and it's become better. But if it's a constant pain and it's started affecting his activity of daily living, his work scheduling, as well as his sleep, his socializing things and all, definitely it is not a good practice at all. Now, popping in pills itself can cause a negative impact, not only on the individual, on the vital organs, as we know that so many of them will be worried saying that if I take too many painkillers, kidney failure will happen, other things, which is all true. At the same time, neglecting it is something which might not be the truth also. They might not know whom to go to. That is also another group of individuals will be there. So therefore, both the concerns of not allowing to be diagnosed properly and not to actually being there to take the exact management plan could cause a lot of detrimental effect on your entire body as an individual. Now, popping pills could have their own side effects, could act upon the kidneys and others, as most of them are already aware of. At the same time, there is something called as rebound pains also, which can happen. Paracetamol induced headaches are rebound pains which can happen. So that's having deleterious effect. Now, any patient who's got one episode in a year or once in a while, that's fine. But if he's got repeated episodes and this pain is not becoming better despite what your treatments you've actually taken to going to a physician, and self-medication is definitely harmful, as all of us know. Now, this is not also giving them, and this pain is actually affecting their quality of life, their activity of daily living, as well as their sleep mood patterns. Obviously, they need to visit a chronic pain physician. That is where we would be able to actually get to the bottom of their concerns, understand the diagnosis, and relevant individualized based plans could be actually made for their appropriate management of their chronic pain.
So, doctor, there are a lot of headaches out there. As you said, there are n number of headaches as well. Even in headaches, there are various types. There's migraine, there's sinus. There are so many types of headaches. So, consider a patient walks into you with a headache. Do you actually get into the roots of getting to know what are the symptoms or what are the reasons, what are the causes, or do you just help him with the go-to solution for it?
So that's why there's a difference why we would actually, even if the diagnosis has not been made, and if we don't have the right kind of specialty seen. Now, vascular headaches, wherein there is some emboli, or there is a stroke, or there is a aneurysm in your brain. We at Aster CMI have neurologists, neurosurgical people, other people also. That is where coming to a hospital makes a lot of difference. So once you come over here, we will understand what is your concern. So a perfect history taking, clinical examination to see what he's already gone through, any investigations or not, what type of management plan has been done, has he been cleared of all the sinister problems. That is something which we will look into. Once those sinister problems are not addressed, we refer them to the right kind of plans over here at Aster CMI. If it's already cleared and they have done all of it and still patient has got pain, then our team, that's only the pain and palliative care team, will look into it. Now, it could be non-pharmacological measures, pharmacological measures, or lifestyle changes, modifications, sleep, mood, psychology, everything is there under one roof. There it becomes very, very important to actually come to our hospital at Aster CMI Bangalore.
So as you said, it's a one-stop solution.
Absolutely. It's a one-stop solution
Get
here.
to know the roots. Right. So doctor, now consider somebody is dealing with chronic pain. What is the usual process of treatment that you all follow for them?
Based upon the diagnosis, based upon the personality, and what they're actually getting affected by that pain, we would target that. Now, if sleep is affected, sleep hygiene measures are told. If mood is getting affected, now psychologists we have. If the depression is too bad, we have psychiatry also. If mobility is a concern, we have physical medicine rehabilitation also here. We have occupational therapy here. We've got the entire gamut to actually enable them with that what is best possible. Now, once these are there, interventions, as I mentioned, there is something called as minimally invasive pain interventions, as I mentioned at my earlier start of my talk. That is where you have targeted injections which made in OPD itself. Now, take for example, simple shoulder injections. Now, for frozen shoulder, or if you have some form of knee concerns, osteoarthritis, specific nerve blocks could be done, something called as genicular nerve blocks. We could inject into the knee also something called as platelet-rich plasma, which is a part of regenerative medicine, or stem cell therapy is what people call about. All these things are done here. Or if a patient has got some conditions like trigeminal neuralgia, which is also called as suicidal disease. One of our actors, famous actor Salman Khan himself had this. Now, we could do a targeted injection called as radiofrequency ablations, which we could do it under the advanced fluoroscopy over here. That's called as the advanced biplanar cath lab, what we use over here. So coming to a hospital like Aster would have not only have an answer to your concern from the diagnosis perspective, If things are not cleared, we'll start from the origin of your cause and then take to the effect, and try to unwind all those things which have been not been done up till now, and take it to the next level, so that we plan that, so that he doesn't have the recurrence back. So the entire aspect what we have mentioned about is not a single person's plan or a single intervention over here. Multi-pronged concerns, multi-pronged approach. Which to be given in which aspect is going to be decided by the patient himself. He is going to give us the history, he's going to give us what it is, and then we are going to plan with his consensus. That is what is the best part of coming to Aster.
Very nice. So based on the causes, based on his history, you'll decide the approach ahead.
Absolutely.
Very
Absolutely.
nice.
Absolutely.
So, doctor, I've also heard of this term called advanced pain management treatments. So, what exactly does this mean, and when is this approach decided?
Minimally invasive interventions, I just mentioned about platelet rich plasma, that is regenerative medicine, or targeted injections do not help. And this patient has got 3 spine surgeries done. And despite that, patient's pain is actually still there. The 4th spine surgery might not get him relieved. Now, are we able to actually do anything more? There are something called as spinal cord stimulators. There's something called as intrathecal pumps. These are all very advanced kind of management. Might not be required for everybody, but there are few people who might be requiring this. There are certain conditions called as CRPS, chronic regional pain syndrome. These are all specific kind of problems which patient would have heard, because they would have been going through doctors, various doctors, and if they have this kind, obviously then the problem also becomes much more complicated, and we would actually be requiring that kind of solutions also. So these are ones which could be delivered here itself, because we have got a hospital which is supported by a neurosurgical team. So these implants to be put into your spinal cord, to your others, to specifically deliver drugs or stimulus which will actually get the pain to be coming down as just touch or sensation, is what spinal cord is stimulators are all about. So these are certain things also offered over here. These are all very advanced forms of interventional pain management therapies.
So, doctor, one more concern that I have is, consider a person has been, delaying seeing a doctor, or he's, been pushing seeing a doctor, even though he's been having chronic pains very often. So, do you think this can lead to an issue where, his pain is irreversible?
The more the chronicity you have, the more the time you would take to recover back from that, because it would have actually done all that kind of damage, not only just physically, psychologically, socially, and other aspects could be there, and it could have deep rooted impact on you, could be on sleep and mood also. So it should be that a person has got pain which is not becoming better for a period of time, and it starts affecting his activity of daily living. That's the time he should not neglect it and should come over, so that we could get to the bottom of it and make this better, rather than having a side effect and a problem which cannot be negated at all.
So, doctor, now if I'd like to dig into that more, supposing somebody has a back pain or neck pain, maybe precisely back pain or neck pain, what is one major mistake that they make that, leads it to a long term impact?
Now, most of them will not come to a hospital at all. They go to the over the counter medications from the pharmacy and pick it up. The government of India has come up with a lot of changes now, and they are not giving these medications as they were used to happen before. But patients also should actually get to understand, saying that it is going to have long term impact on my vitals as well as myself. They should be approaching the hospital. That is where it's all about. And the biggest of the concerns most of them might have is Aster very expensive? Is it something which is going to be a lot of other scans, lot of other problems? As I mentioned in my earlier talk also, we are going to individualize it. We are not going to do everything what has already been tried. There's no role in doing it. And interventions could be very minimal, could be done on OPD basis, or it could be just change of your stretching exercises which you have not been doing right, or just sleep hygiene, other things which you have not been doing right. These are simple things which could be done in OPD basis. So therefore, unless and until you don't have a simple consultation, then we'll not be able to actually give you the entire treatment plan, which is important over here.
So, doctor, consider for any layman, now supposing you want to suggest 3 tips or 3 tricks in a daily lifestyle that you can follow that could help you, maybe stay away. I know it's hard, but maybe avoid or lead to lesser back pains, lesser neck pains, or any chronic issues, chronic pains? What would you suggest? Three simple steps.
First is being happy. That's again a bigger question, whether I'm happy or not. So the first is simple steps of exercises, stretching as you are there, walking, moving when you're sitting, not to sit for long hours, practicing ergonomics, the right kind of posture when you're working on a desk. I think these associated with good sleep is the crux for it. And yes, there are other things like nutrition and other things and health. So that becomes a common tale everybody would put across. But if they're able to do the good ergonomics, stretching, and sleep, I think most of it we will be able to cover under these three.
Very well said. I think makes it pretty simple now for us, right? Yeah. And majorly, as you said, mental well being.
Mental well-being is absolutely a necessary in this era, especially the metros, as well as what you're seeing, the chaos which is happening around. I think at least you are able to actually settle down within your own house, within your own self, makes a lot of difference for you.
So, if I want to simply put it across to our viewers, stay happy, follow good lifestyle, work out a little on a daily basis, don't sit for too long anywhere. These are, I think, four major, and a good sleep pattern as well. These, I think, five approaches, if they follow, should really help them
To a
in staying
large
away.
extent, yes,
Yeah,
absolutely. At least you will not get into that chronicity as much as
right.
possible.
Right. So, doctor, in today's world, there's this new word called aesthetic, right? So, everybody wants to look aesthetic. They want to look perfect. And because of this, there's a lot of people, which is a good thing. I mean, they've started taking care of themselves. They are hitting the gym, they are maintaining their workout routines. But certain people might be even overdoing it a little. Like, as you rightly said before, they might be overlifting weights beyond how much their body could take. So, what are your thoughts on this? Do you feel it is going to be counterproductive?
A very apt question for the youngsters now. Now, if you hit the gym, everything is going to be fine, might not be true. Now, they would actually might not have the right kind of trainer or right kind of training which is for them. Now, if you've not slept the entire night, you're doing 8 hour shift of night shift and then coming to a gym by 7 o'clock or 2 hours of sleep and then going over there, your muscles are going to be really, really bad. And then you're going to work out on that. You're going to tone more, pain is more. At the same time, some of them actually go for deadlifts, 100 kg deadlifts, 120 kg. I've done 140, pumping more. You could have multiple tears, issues, tendinitis, ligamental injuries, damages, and other things. Also a problem there. So too good is also bad. Too less is also bad. So doing things in moderation is what is most important, rather than actually overdoing it. As you rightly put across, it might not be the right approach at all.
So, as you said, too much of anything is bad.
Absolutely. Too much of Amrita is also going to be a problem.
So, doctor, we live in a very new age, smart world where everything is being tracked, be it your steps, your sleep, how your heartbeat, everything A to Z is basically being tracked by our gadgets, be it your smart watches, your phones, XYZ. So, do you feel this approach is in the right direction? Is it good to, keep following these numbers? Is it good to be in relevance with these numbers? Or is there an approach beyond it as well?
Numbers are good when it's done in appropriate or moderation, but it might not be the same if it's overdone or underdone. Now, to give a best example, if you have a condition like diabetes or hypertension with associated cardiac issues, your heart rate can go to a certain level. You need good amount of sleep. These moderations or these kind of specificities would be able to be given by you by your physician only. Otherwise, it will not be possible for that individual to see that gadget and think everything is normal here. It could be different for your father, it could be different for your mother, it could be different for yourself based upon that individual. So the answer is you'll have to visit a physician. Now, if you have a basic understanding of this and you're doing only number of steps or sleep and things like that, it'll give you a certain comfort. But if it's going to have inappropriate numbers over there, obviously it is an alarming feature that you should not wait upon it. You should actually go to a doctor. At the vice versa, somebody might actually not even having a device like that. Then you will have to actually try to start wearing those to get to a point. Now, if you have a predisposed cardiac condition, if you have a watch, it might give you an alarm saying that there is something, a problem going on in the initial phase. Then you will visit a physician. So, therefore, you would have to have in moderation. You could not tell saying that this device is giving me all normal numbers over here, so everything is normal with me, might not be the truth.
Understood, doctor. As you rightly said, everybody's body is different. Every individual is different. But the stats that come from these devices are pretty much general for a general crowd of humans. So it's good to have them. It's good to have them around, but not good to depend on them entirely and not get stressed or celebrate the numbers that are coming there.
And to
Right.
avoid going to a physician, everything
Yeah.
is going to be fine. That was also not. So health
Correct.
checks and other things are already there in vogue. Now that is something which can continue. But to add to that is, what is this? It is not to replace a physician.
Exactly. Right. I think I like that word that you rightly said. It should not replace the culture. It should not replace the approach of getting your medical test done. We should still follow our medical approach that we have been doing, our timely checks, our timely tests. This is just a good way to consult. I mean, I can just have it by my side, but not depend on it entirely. Okay, doctor. Anything that you'd like to tell our viewers who have been watching this podcast till here? Firstly, we're thankful to you for watching and staying with us for so long. So, if anything you'd like to tell them, any quick takeaways or any conclusion or any anecdotes that you'd like to share with our audience?
If they have any chronic pains and they're feeling really helpless and hopeless, please don't feel that. There is a group, there is a team which will take care of their concerns and will be as genuine as possible to answer their questions and get to the solution for them. So I think if they approach the Department of Pain and Palliation, we would be able to actually make their pain as less as possible.
It was really great talking to you, doctor. Thank you so much for spending your valuable time with us and really breaking it down for our audience out there. And to you, our audience, to you, our folks, I'd love to say that in case you are someone, or if you know someone who's been dealing with any of these symptoms, be it the smallest to the largest extent, please don't push it anymore. Make sure you're visiting the right physician, the right pain physician at the right time to ensure that you are away from chronic pain and we are all able to deal with this, making India chronic free.
Chronic pain free.
Chronic pain free, right. Chronic pain free, right.
Healthy mind, healthy body, healthy activity will keep the pain away. So therefore, these are certain aspects which our country is actually to be progressing about. To make our country the best amongst all is what we can actually do.
So rightly, as said by your doctor, I think we are all in this hustle, we are all in this challenge, we are all in this motto to make India chronic pain-free country. I think we can all do it together, as you said. And it's pretty simple. I don't think there is a lot of challenge that, it's just pretty much following the basic steps as said by our doctor today. So, ladies and gentlemen, that's all for today. That's all, folks. Thank you so much for joining us in this beautiful podcast with our doctor at Aster CMI. Looking forward to seeing you very soon in another episode of our podcast. So, stay healthy. Make sure you're listening to your body. And I am your host for today, Harsh Nagpal, signing off. Thank you so much.
Thank you.